Okay, well, again, good morning, everyone, and welcome to our talk on hearing amplification. We're very happy to have you here. I'd like to introduce Allie Heckman and Jennifer, is it McCall? Did I pronounce that correctly?
Just Michael.
Michael, excellent. I can let them introduce themselves just a little bit more and tell you about what they do. And my name is Jennifer Howard. I'm the director of the Turner Senior Wellness Program through the Turner Senior Resource Center. I'm just very happy to welcome you here. And I will go ahead and turn it over to you, Allie.
All right, perfect. Thank you for joining us today. I am a clinical audiologist at Michigan Medicine. I work primarily out of our adult clinics in the Taubman Center and at East Ann Arbor. I specialize in adult diagnostics and rehabilitation, and one of my main focuses is adult amplification with hearing aids, and that is the topic that we brought to you today. Joining me today is our fourth year extern, Jennifer. And so Jennifer, please introduce yourself as well.
So I am actually a student rotating through from the Wayne State Audiology program. It's a doctoral program specifically just for audiology. And so that's what I'm doing at the U of M hospital, is actually rotating through for my fourth year externship. So after this year is complete, I will be able to become licensed as an audiologist. So enjoying my rotation so far.
All right. And Jennifer, if you want to go ahead and start sharing your screen, we can
Perfect. All right. So let's see.
And I also, just really quickly, I wanted to say, you ladies would like to take questions at the end, is that correct?
I think that usually works best. If we would like, we could stop at the end of each section, but I think it would probably flow better, if we just wait for the end.
Okay, fantastic. For everybody who's watching this, just a quick technology tutorial. You should be able to see the three of us on the right, and I'm going to go ahead and mute myself and shut my camera off while you're presenting. But there's a little bar in the middle of the screen, and if you hover your cursor over that, you should get two little arrows pointing to the outside that you can slide that bar back and forth. So if you wanted to make the presenters larger, you can slide it over this way. If you wanted to make the slideshow larger, you can move it over to the other side. Also, if you have any questions, there's a little bar on the bottom of your tab called Q&A for question and answer. Go ahead at any point during the presentation and click on there, and you can ask any questions that you have. And then I will be happy to read those to Allie and Jennifer at the end of the presentation. So instead of waiting and trying to remember what you wanted to ask them, go ahead and just get those questions in whenever you think of them. So we'll just have them in the queue. Okay, and that's it. Thank you, ladies.
Sounds great.
All right. So like we said already, we're here today to talk specifically about hearing amplification. So Dr. Heckman and I will do our best to kind of cover a lot of different topics surrounding that area, and we'll have time for questions at the end, obviously. And so moving into the presentation, we're going to set it up into three parts. Part one is what I will cover for us today. So we're going to look at what you need to know before getting started in this whole process. So there's a few things here just to kind of give you a little outline, a few things that we'll cover in this part. After that, we'll move into part two, where Dr. Heckman is going to start her part of the presentation, talking about what happens before you actually order your hearing aids. And she'll go through the appointment types and expectations. And then also a short part three is going to cover your actual fitting appointment and give you some tips and just some information going into that as well. So we'll dive in. So what you need to know before getting started. A lot of us have seen information come to us through the mail, and we just call those mailers. So these are, companies, maybe local or maybe larger chains that have a system set up where when certain people, when somebody turns 65, maybe it triggers something in a system where a mailer just automatically goes out. So you might notice when you turn a certain age that you start getting all these hearing aid mailers. Some companies utilize that as a form of marketing. But just so you know, the information on the mailer may or may not be very realistic. Sometimes they will have pictures of very tiny, almost invisible hearing aids. And wouldn't that be wonderful if nobody knew you had hearing aids? But it's not very realistic for the majority of people that actually have hearing loss. Most hearing profiles require more power, more amplification than is possible in the tiny hearing aids that you might see on a picture in a mailer. So when I say they might not be realistic, that's kind of what I'm talking about. The information portrayed might not be appropriate for your hearing profile. And also, they are obviously going to try to advertise really low costs and make it sound irresistible. But a lot of times, whatever cost they are showing on the mailer might not be the entire cost that you would be responsible if you pursue devices through that company. And not every mailer has intentions that are deceitful. I hope that's not my message. But just be aware going into those appointments that what you had in the mailer, there might be other costs involved, and you'll need to be sure and clarify those kinds of things if you go through a mailer. But approach those with caution. And also another area that's starting to come about are the over-the-counter hearing aids, and just for short, we call them OTCs. Everybody likes a good acronym. So the FDA will actually be coming out with this OTC Act, which will allow the FDA to regulate hearing aids that are sold over the counter. So these types of hearing aids, again, they're not necessarily for everyone. And that's kind of the message for any device. The over-the-counter hearing aids have their place. They are effective for people with maybe more of a mild hearing loss, or somebody who just wants to try something over the counter first to see, just out of curiosity. That's something that may potentially be available to you. There's another product that's kind of similar to an over-the-counter, but this is called a personal sound amplifying product, or a PSAP. This has been around for much longer. This is not regulated by the FDA. So these are items that you can buy that make everything, it just makes everything louder. Again, it might not be helpful for everyone. Again, just that mild hearing loss is maybe somebody who could try a PSAP. Another important thing is to consider your hearing health. So patients who have other health or medical issues regarding their ears or their hearing should really maintain care with a doctor. So a doctor of audiology would be more appropriate than just buying something online or over the counter. So if you're somebody who has had surgery on your ears, or chronic drainage or pain, even if you're somebody that has dizziness or ringing or humming sounds in your ears, those are all things that would require extra care from somebody who's trained appropriately. So you might see these things like over-the-counter hearing aids and personal sound amplifiers, but just approach those with a little bit of skepticism, just because you might have more hearing loss than what these devices can truly help with. And this again is just kind of another overview of these two types of products. You can think of it like readers for your glasses. So if you're someone who just has a very slight difficulty with your vision, you might just buy some readers at the pharmacy, and you might need nothing else. that might be completely sufficient for you and you're a happy person from there. But the majority of people who have any vision problems probably need to see an optometrist and have a prescription and more appropriately fit glasses that can correct their vision. And an optometrist can look for other underlying medical things through an eye exam. And that's similar and comparable to the hearing world. These over-the-counter products, these personal sound amplifiers, you can consider them kind of like readers. If that's all you need and you find a lot of benefit from that, then that's great. But going to a doctor and actually having someone do an exam and make sure there's no underlying medical issues is very important. And likely you will need more prescriptive correction for your hearing. So we like to use that analogy for these types of hearing devices because people can usually relate more to vision than they can for ears. So that's a helpful way to think of these devices that you'll see over the counter or advertised on TV. Now, moving on to a question about who can actually dispense hearing aids. So this is not something that a physician can actually do. So we have ear, nose, and throat physicians, and they are there to actually diagnose any medical problems with your ears, anything that they can treat medically to help, that's what they can do. But a hearing aid is not something that physicians are licensed to dispense. So there are two areas. There's audiology and there's hearing aid dealers or dispensers. These are the two professionals that can actually dispense hearing aids. And the difference, so an audiologist, it used to require just a master's degree. And in the 90s, they actually did away with the master's degree and required everyone to get a clinical doctorate. So you might see some audiologists that were kind of grandfathered in that still have that master's level, but the majority of audiologists have what's called an AUD, which just stands for audiology doctorate. And so during that doctoral training, audiologists learn about the medical underlying factors that can affect hearing, not just how to fit hearing aids. We're actually learning how to work alongside ear, nose, and throat physicians, physical therapists, and we're learning what ways we can help catch other underlying medical issues simply by looking at your hearing. Comparable to, again, if you think of an optometrist who does certain screenings, or a dentist even that does certain cancer screenings, those are clinical doctorates that are trained to help catch important underlying medical issues when you see them. And that's what an audiologist is trained to do on top of fitting hearing aids. So that's just why they finally made the move to a doctorate instead of a master's degree. We started learning more and more about ways that an audiologist should be treating and helping patients. And then that second type is the hearing aid dealer or dispenser. And this is somebody, they are only required to have a bachelor's degree, and it doesn't matter what area the bachelor's degree is in, but they do have to go through training, kind of like an apprenticeship. They have to work alongside either an audiologist or another dealer or dispenser. And they are required to get a certain number of hours, and they have to complete that training in order to get a state license to actually be allowed to dispense the hearing aids. So they are trained specifically to test hearing and to program and fix hearing aids. And those are great skills. So that's somebody who would just handle that for you, but they wouldn't necessarily have the training to look at underlying medical issues or refer you appropriately to other doctors. That being said, I've met some really wonderful dispensers, so I don't want you to think that they are incompetent necessarily, but if you have concerns for anything with your health regarding your ears or your balance, then I would maybe encourage you see an audiologist. So let's move on from this slide and look at technology. So hearing aids are made by these 7 hearing aid manufacturers. These are manufacturers that work internationally. So they each kind of compete with each other. So as far as technology goes, there's no one company that is leaps and bounds better than the others. They all compete to maintain good competition and good technology among each company. So these are Phonak, Oticon, Signia, Resound, Widex, Starkey, and Unitron. So you may have heard, if you've ever visited an audiologist or a dispenser, you may have heard some of these names. And these are very, very good companies. Some audiologists have a comfort level more with certain companies than others, because it's kind of like getting comfortable with all 7. You're not able to really hone in on all your skills as much. So a lot of audiologists might focus on 4 or 3 just to make sure their skill set is strengthened when they can focus on fewer companies. But any of these companies have great potential to fit any hearing profile. It just helps to know the comfort level of the audiologist with that company. So that's what I have here. So an audiologist might recommend one company over the other simply because they have used it the most, not necessarily because it's better. But whenever the audiologist is confident in the software, confident in the product, that is going to help that audiologist program it more appropriately and more effectively for your hearing. So if an audiologist is recommending a certain company, it's smart to just try that company out, because that's obviously a company that audiologist feels strongly and confident about helping you and your hearing profile. So when it comes to the different companies, if you find an advertisement about one company but your audiologist isn't recommending that, I would still say, try the company that the audiologist is recommending, because that skill set has been strengthened, and the company that you saw an advertisement for may still be a good company. But if the audiologist isn't feeling as strong about that company, then you're not going to have the best benefit from that company. So trust your audiologist or your dispenser with what they're recommending, and at least give it a shot moving forward. The styles. So we all like to talk about the different styles. This picture shows what's called in the ear versus over the ear. So if I move my mouse here, you can see these diagrams are showing what the hearing aids look like on the ear, which it's hard to see, but these first 3 fit in the ear canal. So this one you can see just a little bit of that face of the hearing aid showing. Sometimes they're made a little bit bigger so that it takes up more of the cup of the ear, but these are considered in the ear styles. And then we move to this center picture. This RIE, excuse me, stands for receiver in the ear. So this is where the computer chip sits. The computer software for the hearing aid is behind the ear. You can't even see it. It's way back here in between the ear and the head. And then there's a wire that just comes down in front of the ear. Again, you can't really even see it. And then this little ball is a very soft dome, and that fits down into the canal. In similar way that this one fits, but this is almost preferred probably more because it allows you to have more microphone opportunities. So there's 2 microphones back here that can help with noise separation, whereas this style, there's limited space to put items, and including microphones. So these typically will just have one area where sound can come in, and it's sometimes harder to separate noise and speech. And then these hearing aids are larger simply because they need to provide more amplification for a patient. So this would be a patient who their hearing profile just requires more assistance, more power. So those have to be a little bit larger, but they fit in a very similar way. So these are the basic styles, and these are a little bit easier to see. So again, this is something providing more power to the patient, and this is called an ear mold. The ear mold is custom made and would attach to the hearing aid via this tube here. And then this is a slim tube that would fit into the ear, similar to the receiver in the ear. And then moving on, this is the receiver in the ear. So instead of a slim tube, this is an actual wire, and you can see it better here in this picture. Patients often feel that this sounds and feels more comfortable and more natural than the other styles. So there's multiple reasons why this style is more popular. This can be different colors. Here's an example. You don't have to do blue. A lot of patients will try to match their skin or their hair, or sometimes match their glasses. And then this is a closer up picture of the in the ear style. So again, you've got kind of a smaller in the ear here. And then this is that larger piece that I was talking about. Again, anything that's larger might be so that it can provide more power for the patient. It could also be a matter of simply being able to put the aid in the ear. So a lot of patients that might start to have some dexterity complications might have an easier time with this style because it's molded and specifically made for the shape of your ear canal. And then we can look at the improvements, the advancements that have happened in technology over the years. As we go along, computer chips get more and more sophisticated. As we can see easily with cell phones, it seems like the cell phones used to just be a phone, and now they're tiny computers. So it's similar with hearing aids. The hearing aid, the part that sits behind the ear, is an actual computer in and of itself. So that's why the technology can do so much. The software inside the hearing aid is able to interpret the sound that's coming through the microphones. When I say interpret, it's actually reading waveform patterns. Certain patterns start to evolve in the sound waves that indicate speech. And so the hearing aids can identify that and try to amplify that speech over backgrounds like wind or restaurant noise. So it's all about the sophistication of the computer chip inside the hearing aid as to how well it functions in separating noise and speech. So this is called a signal to noise ratio. So we refer to the signal as the speech, the desired signal in ratio to the noise, the background noise. So when we have an improved signal to noise ratio, that's helping the patient hear speech more clearly in the presence of background noise. And that's what that computer chip in the hearing aid has the ability to do. And not only all of the computer chip intelligence, but all of this makes things more convenient for you as a patient. If of you have had hearing aids from the past, you used to have to hit actual programs, a program button, to make the hearing aid change when you're in a noisy environment, or if you wanted to listen to music, you had to hit a certain button to make the hearing aid change to a setting that would allow for that. With the intelligence that we have now in the computers, that that computer chip and the analytics that come in from the waveforms helps the hearing aid automatically shift its settings as appropriate to your listening environment. You no longer have to hit program buttons. So it's just much more convenient for patients. And another nice thing that's come about in the last few years is rechargeable hearing aids. We no longer have to change batteries, although some people feel comfortable continuing to use the replaceable batteries, which, if that's a comfort level for you, we can absolutely still order hearing aids with the traditional battery system. But the rechargeable hearing aids are very convenient, but they're only available in the types that have the hearing aids sitting behind the ear. Unfortunately, the types that are molded just for your ear canal, those are not available and rechargeable yet. We're hoping that that technology will continue to advance so that we can offer rechargeable in anything. But right now, it's only available in the behind the ear and receiver in the canal styles. There's two ways that rechargeable technology can work. One form is a rechargeable battery pill. So in that type, you would actually have a physical battery that you could put in and out of the hearing aid, but that battery is rechargeable. So there's some good and bad things here. You can actually put a regular battery in that hearing aid if your rechargeable battery somehow stopped working, or if you lost it. So they're kind of interchangeable. But the one bad thing is that rechargeable battery pill really has to be, you have to buy a new one every year, and that can get expensive. So some patients have found more frustration with the battery pill type of rechargeable system. Some of the newer technology has offered us now this lithium ion rechargeable option. We've had more success and more reliability with this type of rechargeable system because it doesn't have an actual door that opens on the hearing aid. It doesn't have anything that you can remove. So because of that, the hearing aid is completely sealed. So there's no cracks or openings for more dust and debris and water to get into. So we found that there's less erosion on the inside of hearing aids because it's a completely sealed case. You would simply put your hearing aids in a charging port that charges that internal battery. But the downside is you can't exchange a regular battery like you would with the other battery pills. So again, some patients prefer to have that control over the battery, and that's okay. If that's what you would prefer, then your audiologist would be able to order something that you could actually have control over. But for the most part, we have seen the most success and the most reliability from our lithium ion system. And I've got so many fun things. Bluetooth connection. Bluetooth is something that has become more popular during this pandemic. For a situation like this, we're having to interact and have meetings and phone calls without people actually in the room. And so the Bluetooth connection is available in hearing aids now. So the actual phone call, or for instance, this meeting right now, would be able to transmit straight into the patient's hearing aids. So that's helpful for not only for hearing the audio better, but it's nice that no one in the room has to listen to what you're listening to. And you can also have better signal, better clarity with the audio input. With the Bluetooth connection going through the hearing aid software, the audiologist has actually programmed for your hearing profile. So the sound coming through the computer or the phone call would be modified according to what your needs are. So that's why patients typically find the Bluetooth streaming to sound more clear, and it's simply more comfortable. You don't have to rely on the volume of your computer or the volume of your phone. You've already got everything to the volume that's prescribed for you when it's streaming through Bluetooth. So again, during this pandemic, we've seen so many patients use this for their work, for interacting with family over their phone calls like FaceTime or Zoom calls. And it also offers a remote control type of option. So the phones can download an app that would work with the company, and it would be similar to turning the volume up and down on your television. It's similar. You'd be able to control the volume up and down for your hearing aids to work in your everyday life. So that wouldn't have to be during a phone call or anything. It could just be if you walk into a restaurant and it's a little overwhelming, you could simply go to your remote on your phone and turn the volume down a little bit. So there's multiple ways that the Bluetooth connection is nice for patients. The next thing is technology levels. So I've talked a little bit about the sophistication of the computer chip inside the hearing aids. That comes in its own different levels. So every manufacturer provides at least 3 levels: this standard, advanced, and premium. So this next point here, the lifestyle that you have, that's very important in determining which technology level you will have the most success with. So if you are somebody who is very active and you typically have multiple different types of listening environments, that is a difficult, those are difficult transitions to make for the hearing aids. So for that information to work correctly, the premium level of technology would be able to analyze that environment as you're moving more quickly and more effectively. Whereas if you look at the standard is kind of basic technology that would be appropriate for somebody who's not as active, who maybe has one person that they're talking to throughout the day, mostly quiet, maybe at home more. But standard is a perfect technology level for that type of individual. I think I might have a slide here. Yeah, sorry about that. And then the advanced is right there in the middle. So the advanced is someone who's still active, but maybe doesn't have as many demanding listening situations. That premium technology really shines when somebody is in a lot of loud noise, but they're still needing to communicate. Or if, some people do a lot of golfing, for instance, and there's a lot of wind, and that premium technology has the ability to help with the wind control. And also music appreciation. There's an extra setting for music in that premium technology. So somebody who maybe listens to a lot of music in their house, or maybe goes to maybe a symphony concert, or any type of music appreciation, that performs a lot better in the premium technology. So when your audiologist talks to you about your listening lifestyles, this is what they're trying to gauge. They're trying to gauge what level of technology would need to be recommended for you to have the most success in your quality of life. It's all about focusing on you as the patient. There's also accessories. So there's so much that you can choose to add. So the accessories are not the primary purpose of having a hearing aid. The primary purpose is to make sure you can understand communication partners to the best of your ability. But these accessories kind of help make other things fun, and if used appropriately, might be very beneficial if there's a lot of background noise and you're still needing an extra little bit of help understanding your communication partner. So these are a few examples. There's a TV connector that would attach to your television, and that would enable your TV sound to stream directly into your hearing aids. And then you could control your own TV volume only for your hearing aids, whereas everybody else in the room would be able to just use the volume on the TV however they're comfortable with. So that's really helpful, especially if there's multiple people watching the television and you seem to always be wanting it louder than everybody else. A TV connector would be perfect for you. That would allow you to listen at your own comfort level and not affect how everyone else is having to listen to the TV. And then there's a remote microphone. A remote microphone is an actual microphone that you could have somebody else wear. For instance, in the car, if you are the driver of the car and someone's talking to you in the back seat, a car is a difficult situation because you can't turn around and look at them because you're driving. That person in the back seat could simply clip on a small microphone, this remote microphone, and their voice would then translate straight into your hearing aids more clearly. So that can be a situation where the remote microphone would come in handy, and you could use it in a lecture situation. Sometimes the lecturer might need to wear this little microphone to stream the sound directly into your hearing aids if you're having trouble. There's multiple situations, and that could be explained more if that's something that the audiologist recommends. And then there's what's called an FM device. An FM device is similar to a remote microphone, but it uses frequency modulated system instead of just the Bluetooth. So it's doing the similar job where it's picking up the person's voice who has the FM device, and it is transmitting it straight into your hearing aids. But it's just doing it through a little bit of a different system. FM devices are primarily used in school systems for students who need to hear the teacher's voice more clearly in their ears. And so teachers have access to these FM devices for their students that have hearing aids. And there's all sorts of fun things that we could dive into, but that's something that you and your audiologist can talk about more in your appointment. But when these things are utilized properly, patients really do enjoy them. There's also assisted listening devices. So these are things that could be used with or without hearing aids. So this is something that that maybe you've learned about even without knowing if you have a hearing loss or not. Sometimes caption phones, maybe a relative has needed a caption phone that plugs in to a landline, and you would need to have a Wi-Fi signal in your house or apartment. But that is something that the government pays for. So that's something that's free to you. You would need a hearing test. The hearing test would be required because you have to show that you have a documented hearing loss. But once that's done, somebody with the caption company would actually come and install this into your home. And when you get phone calls through your landline, you would actually have captioning happening during each phone call. So that's considered an assisted listening device. There's other items that can help you hear doorbells, hear smoke alarms. Some things can actually connect to your like to a lamp and make the lamp flicker whenever a doorbell is rung or an alarm is going off. Or if you have trouble hearing your alarm in the morning, they have little things that can vibrate your pillow so that when your alarm goes off, you're actually waking up to the vibration. So these are all types of assisted listening devices that can sometimes help keep you safe. And a hearing aid is not required to actually be able to use these. Some patients find that once they get hearing aids, they feel they don't need certain types of assisted listening devices anymore. And then some patients do continue to use their assisted listening devices with their hearing aids. Big question. I think everybody likes to talk about cost. Let's get to the bottom of cost. How much is all of this? When we talk about the hearing aids, if you remember the different technology levels, the higher in technology you go, the more expensive it is. So if you think about maybe buying a computer for the first time, if you remember walking into the store, all the computers sort of look the same, and you kind of wonder, why is one more expensive than the other? Well, it's all about the processing power that the computer technology has. So a basic technology level can help you with basic needs. So that's why the lower technology level doesn't cost as much as the premium technology that has the most sophistication on the market and is able to process quicker and more effectively. So when we're looking in this area in Michigan, anything from 2,200 to 6,000 for a pair is kind of the range that has been seen. So again, that 2,200 would be very basic. So that would be appropriate if you aren't going to many different listening environments, if you really maybe only have one communication partner most days, then that's the end of the price range that you might be able to find yourself. And then the higher and higher you go, you're looking at those different, those higher technology levels. So I put a little note here to start saving. If you haven't bought hearing aids yet, it's a good idea to go ahead and just have a separate savings account for hearing aids. As we age, the ear, it's going to start to show hearing loss at some point. Some patients quicker than others, but it's likely that all of us will eventually require a hearing aid to help us hear more clearly. So it's a good idea just to go ahead and prepare for that. Some people want to have the best that there is. So if you're that person, prepare yourself to save for that higher end of the costs. But if you can even just save enough for that entry-level technology, that's going to put you leaps and bounds ahead of people who haven't thought about this and haven't planned for it. Okay. Now, when it comes to insurance, Medicare does not pay toward hearing aids, unfortunately. Even if you have a supplemental plan, if that supplemental insurance says that they follow Medicare guidelines, then they also will not pick up any cost for the hearing aids. It's very unfortunate, and it's frustrating. So again, that's another reason to try to start saving up, especially if you have Medicare. If you have Medicaid, then you will likely have coverage, but it's sometimes hard to find an office that takes Medicaid for hearing aids. U of M does. We can service Medicaid patients for hearing aids. So you do want to make sure you're clear with whatever office you schedule with. Make sure they know that you do have Medicaid, and to see if you do have coverage through Medicaid for hearing aids. And if you do have insurance that has a plan for hearing aids, then that's usually going to cover every 3 years. So some patients already have it planned that every 3 years they're going to use that benefit, but you don't have to. The life of the hearing aid might last longer, and so there's nothing saying you're required to use that benefit every 3 years. But just so you know, it's available to you every 3 years if you'd like to use that. So when it comes to insurance, when you call your insurance to ask about your hearing aid coverage, you just want to make sure you're clear that it's for a hearing aid you're asking about. So calling your insurance company, that person that answers the phone probably answers all sorts of questions about insurance. So they might mistake your question they might think you're asking about a hearing test. And yes, most insurances cover the test, the exam. But if that was a misunderstanding, then you're going to be very upset possibly when you may find out that your hearing aid is not covered. So make sure when you ask your insurance company, make sure they understand you're asking for the actual device, the hearing aid. Some insurances offer what's called almost like a plan through a certain provider. So it's not necessarily a benefit per se. It's not like a traditional benefit. So a benefit would be, the provider sends in what the patient chose, what the patient is being fit with, and the insurance pays that agreed upon benefit, and that's done. When I'm talking about a specific plan, it's almost like, think of it like a discount program through certain providers. So you might hear of a provider called True Hearing, and that is a group that's considered like a third party. They providers who work with this True Hearing, for instance, they are a little bit limited as to what hearing aids they can provide, but insurance would only work with somebody contracted as a True Hearing provider. So some patients do well with that system, but some patients prefer to go outside of that and just use whatever provider they want. So that's something to clarify. You want to ask, is this a benefit with any in-network provider, or is this a benefit only through a third party? So that can get very confusing. Your hearing professional should also be able to look into that for you and help you with that. But if you're someone who wants to do homework beforehand, that's a clarification question to make. And also you want to know who is in network. Just like any doctor, you want to go where you're in network to get access to whatever benefit you might have. If you don't have a hearing aid benefit, then you might just be able to go anywhere. But that's a good question to ask your insurance company. So I think with that, we are going to start part 2. So this is where Dr. Heckman's going to take over. So I'm going to stop sharing my screen. There we go.
All right, thanks, Jennifer. So now that you've stopped sharing, I think I can start sharing my screen. Let's see. And all right, so I believe we should be in good shape here, and you should all be able to see it again. So what I want to lead into is getting into the appointments. At this point, this is everything that Jennifer has been discussing are the things that we discuss in what we call a hearing aid evaluation. A hearing aid evaluation, before we can even get to that, we need a good, accurate audiogram. And so that's a hearing evaluation. And an audiogram is that graph that we plot where your hearing thresholds are. And that is essentially the prescription for your hearing loss. We use that prescription when we're programming the hearing aids, and that helps guide what recommendations we would be making for what type of device would work best for you. Within that hearing evaluation, we are looking for medical red flags, for anything that could be a treatable medical problem that needs medical attention by either your PCP, or if we feel like, you know what, whatever's going on is something very ear specific. If that's the case, then you may get a referral from us to see an otolaryngologist for medical management. If we look in the ears and we see there may be an active infection, or the ear looks unhealthy, or if we see that the ears are different. We always expect our ears to decline in a similar fashion. We assume that they've been all the same places with you because they're attached and you have two of them, so they should be declining in the same way. So those would just be two examples of reasons why we may make a referral to ear, nose, and throat. And what ear, nose, and throat does when they see you is they will give you medical clearance for hearing aids. So if they have done their medical evaluation and have determined that there's nothing further medically that they can offer to improve your hearing loss or your ear problem, then that's when they send you back to an audiologist. And we step in with the rehabilitation side of things. So once we have that medical clearance, we can go ahead and move forward with that hearing aid evaluation, because we now have your prescription of what your hearing loss is and how we should program hearing aids. And that, as Jennifer put in the slide, your hearing is as unique to you as your fingerprint. Every person is going to have, a different plot of the graph, different listening needs, different ways that they perceive speech and background noise. No two hearing losses nor patients are the same. And that's where we feel as if an audiologist is the best person to suit those needs, because we understand all the complexity that goes into making that recommendation, and what barriers may be there for the patient to prevent them from being successful, and what we should do to work around those barriers. So in the hearing aid evaluation, we discuss with you what appropriate options would be available for treating your hearing loss specifically. So it may be that we recommend a specific style based on the hearing loss, whether it be something in the ear or over the ear. We discuss your listening needs and your listening environments, and that helps guide us on the recommendation that we make for what level of technology would suit you and your needs best. We discuss your goals. Are there things that right now are not in your listening environments because you feel as if you can't participate in them? Sometimes patients tell me, I would love to feel like I can go to a restaurant with, a group of friends and feel like I can participate in that conversation. And, I've been having such a hard time, I don't even go anymore. When we start to get into that withdrawal, and we're not participating in those social interactions, that's when we really need to start addressing this if we haven't already. And so discuss those as part of our goals for, what can we realistically improve on? And the more information we have about you as a patient helps guide us in what specific features may be necessary in those hearing aids. We also discussed the cost. Here at our location specifically, we do have an insurance referral team that when the appointment is made, we do call and verify the insurance coverage and have all that information ready at this hearing aid evaluation, so we can discuss all of this as a whole and how it impacts the decision. Other locations may require you to call your insurance and investigate that yourself, which I would encourage you to do regardless. That way you know who is in network, and you can go ahead and jump to the specific steps. Some important questions to ask your provider. When it comes to cost, is their pricing structure bundled or unbundled? Bundled may mean that the cost of the device, the warranty, the appointments are all bundled into one cost, and follow-up appointments may be included in that. So if they have a bundled pricing structure, ask them what is included and what other costs would I anticipate in the future. If a pricing structure is unbundled, it basically means that there is a specific fee for each service. So a specific cost for the devices, specific cost for appointments, and that is actually our pricing structure here at the University of Michigan. We feel as if this unbundled pricing serves our patients best because of many patients that come to see us don't necessarily live close to Ann Arbor. They may be traveling from quite a ways. So if part of the bundled pricing structure includes 4 visits a year, they may not be traveling to see us 4 times a year. We never want someone to be paying for something that they won't be using. And so this unbundled pricing structure, it just seems to be more fair for patients that you're only paying for what you use. So we have separate fees for the devices and then for the hearing aid evaluation. Again, that's not the audiogram appointment, but the actual conversation between you and the audiologist. The hearing aid fitting appointment, and that is the orientation appointment when you get your hearing aids. And then the follow-up appointment within the trial period. That's what I'm going to talk about next. All right, let's see. Hold on, I'm just skipping ahead to see where I want to talk about that. Yeah, so some things that we want to ask our provider in that hearing aid evaluation are some specific things about the hearing aids that we wouldn't necessarily expect you to know. Some hearing aid companies lock their software with proprietary software, meaning that if you buy a hearing aid at a big box store, I am unable to program it here at my office. Even though I may work with the same company, it's proprietary software that's specific for that location. And I think that that's really important to know, if I move or if I want to change offices, am I too locked in here? With the type of hearing aids that we use, if my patients move to Florida, they let me know. I help them find an audiologist in their area that works with those hearing aids because the software is not locked. The warranties with the hearing aids, they come with a repair warranty and loss and damage warranty. That is actually a warranty with the company, the manufacturer, not a U of M warranty. So that warranty goes with a patient as well. I would want to know, what is the plan for follow-up after I receive my hearing aids? I go through the orientation and through this trial period. What do I do for repair? How often do I come back to see you? A trial period is when we receive our hearing aids at our hearing aid orientation. Here at our office, we have 30 days to wear them to determine if they're right for us and if this is worth our time, our money, and our effort. If we find that it's not, as long as we're within that 30-day window, we have the option to return. If we decide, okay, I can tell that I need hearing aids, they're helping, but I don't believe that this is the right one for me. What we do is we try to exhaust all of the options within the programming software and the physical fit to see if the problem can be addressed with the current devices. If we find it cannot, we can exchange. And so we can return and try something else, and that would begin a new 30-day trial period. And so that would be, asking about the trial period and that return policy. So something important to talk about at that hearing aid evaluation is realistic expectations. So we go over with you your audiogram testing and what that means about you and your ability to participate in conversation in certain environments that you feel like you're struggling. With devices, what areas do we feel like confidently that we can improve, and what areas may you still struggle? Our word understanding abilities really is the key factor here. So when you're doing an audiogram test, of course you listen for the beeps and we determine your hearing thresholds, but we also do some speech testing to look at your overall word recognition. We test this in quiet because we want to know, in your best possible listening condition, how clear is speech to you? With that percentage, if it's a poor percentage, then we know that even when we're turning things up, that's the best that we can expect. A lot of different things can affect our word recognition. And so that could be, just as the aging process continues, that we have a harder time processing information in general. And so that lack of processing is going to affect our word understanding abilities as we age. It also could be because of the degree of hearing loss, that if the hearing loss is more severe, we actually can't make things loud enough in the small window of sound that your ear is capable of to achieve that good speech understanding. When we start getting into that range, we may be making other recommendations outside of hearing aids. Maybe we would be talking about a cochlear implant at that point. But the word understanding and setting these realistic expectations of what we think that the devices will and will not help with is really important for the patient. If you know going into this, that this is not magic. We're still working essentially with an impaired system. Just because we can put on the best device possible, your brain and how it perceives that information is still going to 100% impact the benefit that you see. And that's because we hear with our brain, and our ears are just a messenger. So our ears pass along the information, our brain perceives what it means. This is much like our eyes. So our eyes see the letters on the page, but our brain is what's making sense of what that word is. So as far as the adaptation to hearing aids, this is not overnight. It's not every appointment that I fit a new patient with hearing aids that they walk out of here and feel like, wow, everything is amazing. I mean, most of the time we have a very good reaction at that appointment, but also to some extent an overwhelming reaction of, there's a lot of new sounds around me or a lot of things that sound different. And it takes our brain time to learn what is important and what's not. Anytime our brain is perceiving something that's new or different, it zeroes in on it and is really focusing on it. But what it may be focusing on are some of these softer background sounds that you just couldn't hear well before, but also aren't things that we pay attention to on a routine basis. For example, maybe the sound of the refrigerator running and just some of these ambient sounds in our environment. The more we wear hearing aids, our brain learns, okay, I hear that, but I don't have to pay attention to it anymore. And as we continue to wear the hearing aids, that helps our brain adapt over time to where it can focus on what it's wanting to hear, which is probably conversation. And so as we continue to wear them over time, it becomes more natural sounding, but it is definitely not an overnight effect. All right, so the conversation we've had so far is about the hearing aid evaluation, how to prepare for that appointment, and what's going to be discussed in that appointment. In your fitting appointment, this may be called a hearing aid fitting, a hearing aid orientation, or a dispensing appointment. And this is where we make sure that what we have picked is going to be the best physical fit of the hearing aid. So physical fit is number one. It doesn't matter if the hearing aid sounds good if it does not fit in your ear properly. A poor fit will affect the sound. It'll also affect your ability to just wear them in general. Once we have the appropriate physical fit, we work on programming the hearing aids to that prescription of your hearing loss. We actually do that on the computer while you're wearing them. So in real time, you can experience these changes and give us feedback. So the goal of that appointment is to get to a comfortable starting sound quality so that you can go out and wear them in all your normal environments and begin that trial period. Something that is key in what we consider to be the best practice model is verifying the hearing aid programming. So when I input your hearing information into the software, it uses some software calculations to apply how much essentially volume or gain you should be receiving at each pitch. And based on just your hearing profile, what other types of features should become active in that. So I know what I've told the computer to do, but everyone has a different shape of the ear. And the software is actually using an average. They've taken this average in old research from white male veterans in the VA system. And this was back in like the 1970s or 80s. But I have a lot of patients who don't fit that ear description. And in fact, I've never seen an average shape of the ear. So, you know, not only is your hearing profile unique to each patient, but the actual anatomy of the ear is incredibly unique. So to verify a hearing aid, we actually put a teeny tiny microphone down in your ear with the hearing aid, and it takes a measurement at the level of the eardrum so that we know the exact output that the hearing aid is getting. With that, while you're still connected to the software, we can make additional programming changes to make sure that we are at a best target fitting. In that hearing aid orientation, of course, we teach you how to use the hearing aids, practice taking them on and off, as well as just general care and maintenance. I like to see my patients back, of course, for an additional appointment within that trial period. So after they've had the opportunity to wear the hearing aids, they can give me their feedback on what sounds good and what doesn't, you know, what improved and what problems developed, so that we can work through those and do some follow-up programming. So the hearing aid programming can always be revisited, you know, even in the coming years. So if 2 years down the road, the hearing has changed, we can reprogram the hearing aids in the same way that we did the hearing aid fitting. All right, so here's the trial period slide. So I think I already talked about some of this, but that trial period when you are in your hearing aid evaluation, that should be something that's very clear. So make sure you ask the appropriate questions to make sure that you understand how that process works and clarify that with your audiologist. All right, so in a past presentation that I've done for the Turner Center, I had a section and it was commonly asked questions about hearing aids. And we didn't have time to include it in today's presentation. And some of these commonly asked questions are things like, you know, back in the day, the hearing aids used to whistle. What is being done for feedback management? You know, and just, you know, some of the concerns about hearing aids that prevent us from moving forward. So I have that prepared in a handout that I can provide to Jennifer Howard. And then if you have interest in that, she can let you know how she can get that to you. All right, but I do think that we are ready for questions, and I think I saw some actually already in that chat. So I'm going to stop sharing my screen so we can go back to that.
Okay, great. Thank you, Allie. We do have 3 questions that are queued up already. And again, if anybody wants to ask questions, feel free to click on the little Q&A box at the bottom and you can submit your questions anytime. So the first question is, are power aids available with the receiver in the ear?
Good, I'm actually really glad you asked this question. So the receiver in the ear style where, you know, the microphone is in the behind the ear portion of the hearing aid, and then it's attached to the speaker wire. The speaker wire in coming years, we've been able to get much more powerful. So I've really been able to fit a wider range of patients with that receiver and canal style. Part of the key and able to make it powerful enough is how it's physically fitting inside the ear canal. When I need more power for a hearing aid because the loss is more severe, I need to occlude the ear more. So I need to block more of the ear off so that the sound isn't coming out and the patient's not getting the benefit, but also so that it's not feeding back. Feedback, for those who don't know, is when the hearing aid is letting sound leak out and then it's picking it up again, it creates this feedback loop. And what we hear is whistling. it's not uncommon for the person wearing the hearing aid to not hear the whistling because of the severity of their hearing loss, but other people around you can hear that. So what we sometimes do to make it a more powerful hearing aid is take a custom impression that the speaker is actually embedded inside of that impression. So we would send that impression to the company, and they would make a custom mold of your ear to attach to the behind the ear portion. So we are able to fit much more severe hearing losses than we used to with that style. All right. And I see the second question, and I'll just go ahead and read it. Does the TV connector utilize Bluetooth to talk to the hearing aids? And also, what is the range of that TV connector? So the TV connector does communicate via Bluetooth. So those two devices, the TV connector and the hearing aids, have to be paired through Bluetooth. And that's something that your audiologist can help you with in office. Sometimes it also has to be connected to the software to make sure that they're communicating properly. And then the range of the TV connector is going to vary amongst manufacturers, but it tends to be pretty good, about 10 to 30 feet. So I have a lot of patients that, can listen to television and walk around their house and still hear their television. So if you're, a sports fan or something, you never need to miss a moment of the game. The third question that is here is, how are remote programming adjustments handled? And what is the cost for this service? So this is an excellent question. And the reason why we didn't include it in our presentation is because right now we don't know. So remote programming is relatively new, where we can have telecare or teleaudiology. So where I'm actually capable of programming hearing aids from my office and computer while the patient is at their home. So how this works with the software, as far as the hearing aids that are capable of it now, it usually connects through a phone app on the patient's phone. And for some of the manufacturers, you can actually talk to the audiologist in real time, so much like we would in a regular fitting appointment. Some of the software with the company is handled in real time, where I send the changes, and after a brief delay, the patient is experiencing those changes right away. Others, it has to be downloaded from the phone and loaded into the hearing aids. And that can be done in their home for that. And so this is something that's really just been rapidly changing, especially with the pandemic, and a really important service for audiology to dive into moving forward. So right now at U of M, we have hearing aids that are capable of telecare, but the trick is, of course, the billing and the cost for the service. So the billing codes are still being built in the state of Michigan. And so we are still waiting for essentially the go live and permission from the university and from our state organization to be able to offer this. Some ways that other clinics may be able to get around that is to just not bill it to insurance in any way. And so it would just be a self-pay fee. We are waiting to make sure that we have all of our ducks in a row before this is something that we can launch. It's not uncommon for these types of changes to take a little bit longer in a hospital system. There's a lot of security and privacy things that have to be addressed. And when we're talking about multiple manufacturers, we need to make sure that we're protecting our patients' safety and privacy of their health information. So there's just a lot of boxes to check before we're able to offer that. All right, I see a couple more here. So about how long is the high-tech hearing aids expected to last? So it actually does not necessarily depend on the level of technology, but just the device itself. So in my experience, it's not that the premium hearing aids last longer than the standard. I am finding that the hearing aids are much more durable than they used to be, especially the lithium-ion rechargeable hearing aids. reason why is there's no longer a battery door. And the battery door before was an opportunity for moisture and debris to get into the electronics of the hearing aid. Moisture issues, issues with debris causing problems in the electronics. Those are all things that are covered under the warranty. And each company will service hearing aids for a certain amount of time. So usually about 5 years. After 5 years, we have to usually send it to a different type of lab that's not manufacturer specific to continue to have it repaired. I typically find that hearing aids last about 5 to 7 years if they're well taken care of. When we get into that 5 to 7 year range is when we start to have more repair issues, much like an older car. It takes more effort, more energy, and more money for upkeep. And that's what we find as the hearing aids age. And that's just from, typical wear and tear. And we've seen with electronics over the years that they don't last forever. All right. So a lot more questions coming in. Thank you. If you make an appointment for a hearing evaluation or hearing aid at U of M, is that with a clinic and a random practitioner, or can you get an appointment with a specific practitioner whom you'll see every time you need a follow-up? So that's a great question. Here specifically at U of M, once you begin the process with one audiologist, we prefer you stay with that person just to help with continuity of care. So when you are scheduled with a certain audiologist, you should be told what days they are at that clinic and what days that they see hearing aid patients. So that way you know if that's going to work in your availability. So for actual programming follow-up, you would continue to see that same provider. If you have repair types of issues, here in our clinic, we are very lucky that we have hearing aid technicians that work with us in our clinic. And they can see you usually much quicker on the schedule than we can. So it wouldn't be uncommon for, if you call with a problem with a repair type of issue, that they would say, oh, I can see you today or tomorrow and get it addressed very quickly. So for repairs, you may see different people, but for programming, you would continue to see the same provider. So 7 makers of hearing aids were listed. Is Siemens also among one of the hearing aid manufacturers, or does that company distribute hearing aids from one of the makers you mentioned? So actually Siemens hearing aids were bought out by Signia. And this was about 5 years ago. And so their parent company is now Savantos. So they sold off their hearing aid division to Savantos and they rebranded it as Signia. But we were lucky because they kept all the same people. And so it was a very easy transition. So it still has the good Siemens quality of hearing aids that it was well known for. And so it's still a similar sound quality as well. And so technically not exactly Siemens, but Signia hearing aids are going to be very, very similar. And what brands does U of M deal with? So we work with 6 of those 7. And so those would be Phonak and Unitron are owned by the same company. Signia and Widex are now owned by the same company, as well as Oticon. How many did I just mention, Jennifer? I might need you to pipe in.
I think you mentioned 4 already.
Oh, Resound. So Phonak, Unitron, Oticon, Signia, Widex, and Resound. So the only one that we don't work with currently on that list of 7 would be Starkey. And that is just because we feel as if the other companies are offering what our patients need. And just the way they set up their business contracts and things, those 6 are going to best serve our patients. Is the rechargeable battery, when the rechargeable battery needs to be replaced, how long does that take? So for almost all of the manufacturers with the lithium ion rechargeable, it actually has to ship to the company to have that done in the same way that for a repair process. So if we're unable to repair a hearing aid here, we send it back to the company under warranty. And it's the same process for that rechargeable battery. Our warranties here actually last 3 years. And I always recommend to my patients to send their hearing aids in for a warranty repair. So when we get close to the warranty ending, send the hearing aids in, because it's much like driving into the mechanic shop and coming out with a new engine in your car. So they replace all the internal components, including that rechargeable battery. So the turnaround time on that is usually about a week and a half to 2 weeks to ship it out, have it replaced, and then ship it back to the clinic. The manufacturers, none of them will ship directly to patients, unfortunately. All right. I think I saw all of the questions go away.
I think, yeah, I was dismissing them as you were asking them, Allie, so we didn't get confused. And one came through the chat, but I think that person moved it over to Q&A too, so you answered that question. So I think we have answered all the questions today.
Wonderful.
Yeah.
So I appreciate everyone joining us today for the presentation. And if there's any follow-up questions that come through, Jennifer, I'm happy to answer those if you have any to collect, and see how we can address those moving forward.
I did in the chat box, I did share my email address, but I will go ahead and say that if you have any questions or follow-up or need resource materials, you can contact me at jwhoward, that's HOWARD, at med.umich.edu. And again, that's in the chat box. So if you need to reach me, go ahead and shoot me an email anytime.
All right. So thank you for asking us to come today. I wish we could all see you all in person, but hopefully we're going to be able to do those things again soon.
All right, ladies, thank you so much for being with us today. Thank you to everybody who tuned in to listen to this presentation. And again, if you have questions later, feel free to reach out to me by email. We are working on getting these presentations onto our website with closed captioning. It's going to take a little while. We've got a company that we're working with to try to get this done. So look for that. And if you have, again, further questions, you can check out our website for Turner Senior Wellness Program. We just released our new newsletter with all of our upcoming talks, and this was the first one. I think there's some people who didn't even get it in the mail yet, but really appreciate the people who saw it through our e-news and who could be here today. So, and I think that's it. Thank you, everyone.
All right, thank you.
Thank you. Bye-bye.
Bye-bye.